Hi, I'm Adrienne, one of the midwives at the birth center. We'll just take a tour of the center. We do have some patients here for their prenatal visits, so if you see people here, just know that. So we'll come right this way. We have a lobby area where people can wait, family members. It's a very comfortable setting. Um, Unlike a hospital setting, we don't have any other patients here other than the women who are laboring. So we don't have sick people here, so that's nice. And we deliver all of our own patients. All the people that, the women and families that plan to birth here, we have 2 full-time midwives on call that will attend those deliveries. We have 24-hour call coverage all the time. And one of the things that we do well is that clients have a familiarity with the center, with the staff. You know who's going to be at your delivery, and we do natural childbirth here. So there's lots of a continuity of support that women are getting, which is very nice. We'll come right this way. We have actually some group prenatals happening today, and one of our staff members is coordinating that. We make all these lovely quilts of babies that are always born at the birth center. We'll head right into the birth room because we have some other patients around the center. So this is one of our birth rooms here. Like I said, we do natural childbirth. It is a freestanding birth center environment. We care for women who are low risk and healthy and not having complications in their pregnancies. We do lots of water birth. Women can use the tub and the water in the course of their labor. One of the things, this room looks very much like this, and women come for their visits here and they're very familiar and they know the space that they're going to give birth. In addition to birthing in the water, you know, here we don't do interventions like starting an IV, although we can do that for sure, but we monitor the baby intermittently in a safe way. But women, those things allow women to be mobile. And when women are mobile, they can progress better in their labor. They come into the birth center when they are in an active labor pattern. So they may be talking with the midwife over the phone and then come in. Other things we have to promote mobile birth, vertical birth, you know, birth balls. This is a birthing stool under here where women can squat. This is a lovely, we call it a yoga hammock, but women can use this to squat in. It also is shorter where you can, you know, squat like this on it or lean into it and hold it like that, because these are positions where women could rest in their labor. They could achieve vertical positions to help the progress of the baby. We also utilize the shower. We can come in here and we have a great walk-in shower space where women can sit on this stool to be in the shower. We have lots of exercise balls to help keep the baby rotated during the course of the labor. And again, because we're doing natural childbirth, we don't use any kind of narcotic pain medication. Instead, we do comfort measures as well as a continuity of care and have a system of care providers, our whole staff. What we do is natural birth, so women achieve that end. Because we deliver babies and we're not in the hospital, although we consult and collaborate with, we're located in very close proximity to a high-level tertiary care medical center with high-risk obstetricians that could manage complications if they should arise, which is rare here at the birth center. But nonetheless, it could happen. We have to be prepared and equipped to manage an emergency with a baby, with mother, and we can stabilize those things if we needed to wait for the next level of medical care or continue to keep something in normalcy so it does not become a risk. We also work with if a baby needed help breathing, we have equipment right here in the room, again, to work with a neonatal emergency. Unlike the hospital where the baby's born, the cord is cut, the baby is brought over to an infant warmer and sort of separated from the mother, we don't typically do that here. Baby is born into mom's arms, breastfeeding can be initiated right away, which is really lovely, and the mother can bond, particularly that first hour is a really nice special bonding time. However, we wouldn't hesitate to assist a baby, and we have space to do that. We're equipped with oxygen. Like I said, we have medications to control hemorrhage with mother, provide oxygen to the mother, but we don't overly use these things. We're monitoring the baby just with a Doppler. We're monitoring vital signs. We are charting all those things. And after women have their baby, they stay for about 5 or 6 hours and then go home.
Thank
Was
you.
that too long?